What's up, guys? Welcome back to the nursing channel. So today I wanted to take advantage of the beautiful sunshine. Look at this sunshine, look at this glow over here. Well, anyways, right now I'm going to answer the question, what is a utilization review nurse? Okay, and as you guys know, I'm a nurse case manager, and case management, the department is broken up into two sections. So you can either do discharge planning, or you can either be a nurse discharge planner, or you can be a utilization review nurse, okay? And today I'm gonna talk specifically about what a utilization review nurse is. So a utilization review nurse is a nurse that goes through patient charts, okay? So as a utilization review nurse, you're going to be reading a lot of notes, a lot of progress notes, a lot of physician notes, and your goal is to determine what is the reason for why the patient is here. Your job is to medically justify why the patient needs to be hospitalized, okay? And you're going to find that justification through reading the doctor's notes, okay? Once you've determined that there is medical reason for the patient to be hospitalized and taking up a bed in a hospital, then what you're going to do is you're going to make sure that the patient's insurance is aware of this information. And you're going to do this by sending the insurance clinical notes, the patient's clinical notes, and that's going to include the history and physical progress notes. You're also going to use a tool called Innerqual, and this tool called Innerqual provides you with guidelines that the patient needs to meet to medically justify their stay. For instance, if a patient comes in with a diagnosis of COPD, okay? So what Innerqual is going to, when you use the tool Innerqual, it's going to walk you through the types of treatments that the patient should be receiving for a diagnosis of COPD. For example, patient got diagnosed with COPD, was admitted for that reason. Innerqual is going to tell you, does this patient have an oxygen saturation of 89% or less? And you're going to look through the patient's vital signs and try to see if the patient had an oxygen saturation of 89% or less. Did this patient get at least 3 breathing treatments within a 24-hour period, okay? Is the patient utilizing supplemental oxygen? So this is what Innerqual is gonna guide you through, and you're gonna be checking little boxes in the Innerqual tool to see if they met this criteria. And once they meet all the necessary criteria for that specific diagnosis, you're gonna get a green light, or the boxes are gonna light up green, and that tells you that the patient has met medical necessity, and that their stay in the hospital is medically justified. And once you get the green boxes, you're gonna fax it over to the patient's insurance, whether that's a Blue Cross, whether that's Blue Shield, whether that's Partnership Health, whether that's any private insurance or any insurance. You're going to make sure you forward these clinical reviews to the patient's insurance so that they're aware of this information, and they will reimburse the hospital that you work at for their stay, okay? So that's essentially what a utilization review nurse does. And there's other things that we do within utilization review, but I'm not going to talk about that today because that will require more time, and I don't want to confuse you guys. I want to make sure you guys have a general idea of what a utilization review nurse is and what they do. All right, guys, I hope this video helped. I will see you guys later. Thanks for being a supporter of the nursing channel. Once again, if you like this video, don't forget to hit the like button. And if you find this information useful and helpful, don't forget to subscribe, guys. All right, I'll see you guys later. Love you guys.